delighted to be able to introduce who is Richard Cox. So Richard's career showcases impressive progression from critical care and acute nursing roles to becoming Chief Nursing Informatics Officer at Manchester University NHS Foundation Trust, or MFT, in early 2024. His early interest in digital healthcare led to regional and national recognition, particularly for his work improving technology for acutely unwell adults. As a key clinical leader, Richard successfully implemented the MFT Hive electronic patient record program. This is one of the largest rollouts in England, and it was done overnight, and it was incredibly impressive. And he's developed a unique multi-professional digital healthcare team. In his current Chief Nursing Informatics Officer role, he provides senior leadership across MFT, identifying opportunities to transform healthcare practices through improving digital systems. So thank you so much, Richard, for being our first speaker, and I'm just going to hand over to you now.
Thank you very much, Jude. A pleasure to be here, and thank you for spending your lunchtime with me to hear about what I'm going to say. So what I'm going to talk about, if we just move to the next slide, is digital health and our professions, and having a bit of a think about what our future may look like. I'll just tell you a little bit about myself, just so you know who you're dealing with over the next 35 minutes or so. If we just move to the next slide, please. So as Jude mentioned I started my career in Leeds, in cardiology, in the Leeds General Infirmary, came across to Manchester and came to cardiac surgery high dependency, then spent a bit of time in Australia in critical care, came back to Manchester, and that's where I joined what was the acute care team, which is still going strong today. But a key part of that role was around how digital technology could improve that pathway of the deteriorating patient. And I found that fascinating, of how digital clinical practice, policy, governance could all work together to really deliver safer and improved patient care. So I stayed there for a fair few years within that team because I found it absolutely fascinating. Moved into a lead nurse role in CSS, which is one of our clinical groups in MFT. And then in 2019 came into a much more dedicated digital role as head of nursing. And that was the first dedicated leadership role for the NMAHP professions at that time as well. And like Jude mentioned, I was lucky enough over that period of 2019 to now is to build a multi-professional digital nursing, midwifery and allied health professional team as well. And I'm incredibly lucky to be surrounded by such curious and enthusiastic individuals that I learn from every day as well. But really proud of what we've developed there together. The reason I came into digital, I find it an incredibly collaborative space, really. Great support and mentoring up and down the country from my colleagues. And I think how MFT positions itself as great specialism and a load of opportunities to get involved in as well. If we just click once more, the most important bit about me is my dog. So that's Lucy. She is a rescue greyhound. She's 10 years old, but she brings me great joy as well. So that's about me. I guess just to give you a little bit more information around the presentation today, what I'll be looking at is some practical examples of digital practice, and whether that would fit into our future as well, what that may look like for us. Look at industry as well, of what they're saying, what digital technology is coming forward, and again, think how that may assimilate into our practice as well. We'll highlight some of those limitations as well, and also look at some of those professional tensions as well, that may be barriers or opportunities that we can explore as well. Having spoken all about that, then reflect on how we as leaders can make sense of all this, and then look at next steps. So that's quite a lot to get through. So stay with me. Let's move on to the next slide, please. I thought would be really useful is if you just scan the QR code or jot the URL down into your browser. I'd just really like to understand in a few words of how you think digital technology can improve care. And just take a few moments to look at that, please. Only a few words. It doesn't need to be reams and reams, but I just want to get an idea of who I'm talking to today. We'll just give that a couple of minutes. Okay, so some clear thoughts there around efficiency. Nice. Improving that visibility to aid patient safety, get rid of duplication. Data, yes, huge one. Nice. Wonderful. So a lot about safety, efficiency, improving quality, essentially. Amazing. There's loads coming through. Wonderful. Great. Well, I'm in great company. It's clear that you see the advantages of digital. So that makes this conversation much easier, I guess, that we're on very similar lines there. So thank you very much. Thank you for that. If we're able to move to the next slide. So starting with, as I said, looking at just some practical examples that I thought we could explore together. So the first one I looked at was keyboardless documentation, which is a bit of a mouthful there. So what I'm really talking about there is that ambient voice recording AI technology, or ambient AI you may hear as brandished. And this is an example that is actually taken from our EPR that we use in our acute hospitals, so Hive. This is just around the corner, really. And what this is enabling kind of your handheld devices to listen to that conversation with your patient. And then through that, the technology actually documents in the system for you. So we've got the examples there of that could be a set of OBS, pain assessments, fluid balance, documenting that patient admission, general note taking. So some real opportunities there. But what would that look like in practice? So here's just a few examples of what we might need to think about. So first of all and foremost, that patient consent and understanding. Does the patient understand that where that data is going, that it's not going to go into some cyber world elsewhere, it's going to go straight into the record, understand what you're going to be doing, what that device does. So making sure you've got the understanding and the patient's got that understanding as well. The idea then is then you use your device. So if we think about our wards at the moment, that would be using, for instance, like your Rover device, which is like an iPhone device, placing that on the desk in your top pocket, so it can pick up that discussion with you and the patient, communicating in a closed loop style. And that's quite important to think about in practice as well, is making sure that the technology understands what you're doing and what you're not doing and what you've done. So it just makes that information that's presented in the EPR as such much clearer and it'd be much more comprehensive. Once you've done that piece of work, had that conversation, end your recording, and the most important thing then is just reviewing the accuracy of that conversation and make sure it's populated appropriately. So the real advantage there is that really meaningful interaction with your patient without necessarily having technology or hardware in the way of that interaction with your patient as well. So it's much more discreet. So that was one example. So just think about that for a little bit and we'll move on to the next one. So if we can have the next slide, please. The next element I thought we could look at is patient well-being, and we've got a link to the study there. But can we enhance patient well-being through AI? I thought was an interesting question. So, supporting patients to express self through art therapies, and what's AI's role in that? So if we think about what that technology would need to do, it could tailor to the patient needs and be available to all. Because it's technology, there's the potential of it being available outside of the classroom, potentially reducing workforce demands and perhaps not needing as many facilitators in such domains. Again, because it's technology and the accessibility around it, it would be available 24/7. Thinking about how the individual could interact with the art therapy. Perhaps it could enhance conversational abilities. So by the actual individual talking to the technology, it would develop art on that conversation. and ultimately allowing creation of art with varying levels of participation as well. So really, really inclusive approach, not just relying on motor skills as such. So again, if we think about and what the study was showing is how that may look in practice. So the patient is encouraged to express through commands and prompts to create AI art, again, developing that conversational ability, that confidence. No requirement to be an expert, so you don't need to be an artist. It is available to all, inclusive of all abilities as well. And I think this is a really important one as well. It's breaking down that barriers, not reliant on those motor skills, as I've mentioned. So using voice or actual motor skills as well. What this study showed that there was more research required to validate this. Patients seemed to like it, individuals enjoyed doing this, but it needed more research. Where we saw this in use in this study was particularly with aphasic patients and support of expression of individuals living with neurodiversity as well. So again, another example of how technology could enhance interactions and care with our patients. If we move to the next slide, please. Thank you. The next one's around conversational agents. So can telephone chatbots support patient queries? So this study was from Japan. And it was particularly related to cancer patients, and part of their pathway that they had regular telephone follow-ups. But what they were finding was demand was increasing, but actual workforce was decreasing. So there wasn't always that ability to have the interactions on a timely basis with patients. So this was looking at, could chatbots support this? So the idea of the chatbot would be it would address a range of lay topics that the patient may ask. They thought through this, it may enhance health literacy as well. So if people do not necessarily want to read information or are unable to read information, they could just have that chat on the telephone to get the information they need whenever they wanted it. Again, reducing that workforce demand, because that was becoming a huge element in this study for this team. And again, available 24/7. So the patient could access information whenever they needed it, any time of day, and perhaps really alleviating some anxieties through that as well. So looking what that looks like in practice, and again, this is all related to this study, is that what they found that the chatbots were really in the infancy in healthcare. Where they were used, it was very much for around treatment monitoring, so just certain data types, giving numbers, things like that, or service support, so signposting to where to services that were available to the patients or individuals. There was limited research as well, which didn't help matters of when trying to kind of explore this area. And what they found, the actual technology was a bit of a limitation as well. So there was a real difficulty providing data to support machine learning and natural language processing. So what that really means is that as people, we can say things in all different ways, we can ask numerous questions, and the technology wasn't necessarily reliable enough to give the right answer. So there needed to be much more research and much more training of models to be able to do that. And you'll see a bit of a theme here as well is around some of these are examples saying there's limited research there. So we need to know more. Keep that in mind as well. Okay, so let's move to our next slide, which beautifully takes us to AI in research. So is there a role for AI to support NMAHP research? And this is an interesting question. And when I've asked it previously, these are often the answers I get is that, well, is it cheating? Is it really ethical? Well, it could support us with some large data sets. And could it improve efficiency? And the reason why I was thinking this and why I asked this question was, as I've just mentioned, through those couple of examples we've just looked at, authors are citing there needs to be more research. So could we help that efficiency by utilizing AI in our research practices where appropriate? So what that may look like in practice. we've already said it could facilitate complex data analysis, really improve that efficiency there. It also looks at interdisciplinary collaboration as well, and I think this is a really important element. I think there's a role for AI in research, most definitely, but it's about the transparency. It's about saying that we're using it. It's about having confidence in the AI that we've chosen to use, and that goes to this point here around the importance of interdisciplinary collaboration, ensuring that we're getting those. And we're making sure that we're getting the ethical and legal considerations right as well. So what that means is working together, working with our researchers, our ethicists, our policymakers, our users that are actually responsible for putting data into our systems as well, of making sure that we've got confidence and we trust the data that we're using with, and therefore we can trust the AI models as well. And we'll go into a little bit more detail what that might look like as well. And again, that's exactly what the study referenced says there as well. So there's probably a real good case for that as well. Thank you. So if we just move to our next slide, I've got another question for you, and just see what your thoughts are. So out of those examples that we've looked at, do you think they could be used in your practice? Could you see them happening in your areas that you work? Maybe not all of them, but maybe some of them. Interested to hear your thoughts. Let's give this a couple of moments so you can log back onto Slido. Nice, we have a bit of a split at the moment. Give it a few more seconds. This is exciting. I'm loving seeing all the changes so rapidly. Okie doke. Right, so I think it's looking like there's a definite majority there that, yeah, we could definitely see this happening in our practice, which is great. Still unsure, probably need a little bit more convincing, or need to understand a little bit more to see how that would work in practice. Thank you for your input there. No one is saying no at the moment, it seems. Okay, thank you. So let's keep moving. So if we move to the next slide, if possible. So we've looked at some examples in practice in healthcare, but what's industry saying? So here, on this slide here, there's two kind of, I guess, they're think tanks as such, Gartner and McKinsey, telling us what's coming really. So if we just look at the Gartner slide here, and there's some words here that are interesting, we may have never seen before, but hopefully I will guide you through these. So Gartner, they look at three areas of top strategic technology trends. So around AI imperatives and risks, they've got one of their top technologies here is agentic AI. What does that mean? It means really autonomous AI that's actually essentially a virtual workforce. So what we see there is AI almost becomes part of the workforce, is its own workforce in itself, and augmenting human work. Fascinating to see where that goes. The next point here, really importantly, is around the AI governance platforms as well. Making sure that there's responsible use of AI as well. I highlighted a little bit of that in the last slide, but making sure that we have systems, practices, policy in place to keep us safe with AI as well. And I think the technology at the moment is moving much faster than policymakers are, but there is definitely things we can do, and we'll explore that a little bit more around what we can do as an organisation, but also as individuals as well. Also, the next one is around disinformation security, decreasing fraud, again, dealing with facts. The next item here under new frontiers of computing. So post-quantum cryptography. Amazing. So data protection that is resistant to quantum computing, so around security and really complex computing. Another area that I thought was quite fascinating is the ambient invisible intelligence technology here. So seamless and unobstructive technology supporting real-time tracking and sensing of items. So again, thinking how that may make our lives more easier in the future. I can definitely see how that would take away some admin burdens. Interesting. The next bit, and again, a really important one here is the examples that we're talking about, especially in this list here, will generate a massive amount of energy and consume a huge carbon footprint. So lots of work looking at how we make computing much more sustainable and reducing that energy consumption as well. Really important point. The next bit around hybrid computing, hugely complex, again, around that human capability of computers. The next item here under human machine synergy, and these are really interesting ones as well. So spatial computing, this is really around VR supporting education and immersive experiences, allowing us to actually make mistakes, not on people, but actually in a virtual world. And I think we've got some examples of that across MFT already. And it's great we're at the forefront of that, but how VR could really change how we educate as well. Polyfunctional robots, so that's basically robots that can do loads of things, that can do multiple things for us. And we'll discuss a little bit later of what robotics might look in our world as well. And then another one here around neurological enhancement. So again, really interesting for educators. So improving thinking abilities of computers that can really tailor education to the individual, and potentially supplement gaps in people's knowledge, ensuring that they could potentially work longer. The example that Gartner gives, that allowing an older workforce to work longer through that tailored approach to education, and also supplementing where there may be gaps as well. So really interesting how technology can really ensure we're delivering personalized education to our citizens and people that we work with as well. The next part of the slide there, just from McKinsey, I won't spend too much time on it, I'm conscious of time, but this was from 2024, and what all these circles are really showing is all the technology that's going on, and which is most innovative. That top circle you see at the top is AI, and that is leaps and bounds above a lot of the tech at the moment. And it's big business. In 24, I think McKinsey kind of mentioned it was worth around $120 billion. I think that's very conservative. From some of the discussions we were just having yesterday with the team, there was some evidence really showing that this is much bigger business than that, and we're talking, 500 billion, 700 billion. It's big money. So what I'm saying is we're not going to escape this. We're going to see more and more of technology evolving at rapid paces because of the investment that's there as well. But I just thought interesting to share with you what industry's saying, and thinking about where we may go as healthcare professionals with some of this technology as well, and how this would work with us in practice too. Let's move to the next slide. So all that's wonderful. I've painted a really lovely picture, haven't I? That there's lots of opportunities for technology. There's lots coming our way that could really support how we care, how we look after our patients. But there's a bit of a but here as well. So these are a couple of articles that I pulled out really around. Researchers say an AI-powered transcription tool used in hospitals invents things no one ever said. So interesting, this one. It was a bit of an ambient tool that was generating things weren't said, was fabricating information, saying that patients who are on drugs that they weren't. This can happen with AI. It is a computer. Um, and I guess to me, it highlights the importance of the human in this, and the importance of us as professionals and our role within AI and technology as well, is that we have to be the overseer of this as well. The next one we've probably heard a lot around is around the biases in AI, and what do we do about that? And I think around that, so what we're talking about there, sorry, is around an AI tool that may be trained on a very small part of the population that isn't representative of how the tool is supposed to be used. And I think what's really important here is that final sentence in the box there around AI can help humans with bias, but only if humans are working together to tackle bias in AI as well. So again, going back to my earlier point of how important it is how we all have to work together to collaborate on the AI that we are using to understand, build trust, gain confidence in. Let's keep us moving to the next slide. So that takes us to a bit further to think about our professions, digital and professional tensions. And there's a whole range of articles I looked at for this. Um, and they were quite fascinating, really. So the professional challenge, what's in front of us as professions? There is a lag of embracing technological advancements. This is particularly seen in nursing. There's a tension there, and I think this relates to some of this. The tension of patient rapport, empathy, and human touch versus a world of rapid evolving technology. Thinking about, does technology affect that patient rapport? Does it affect us? Is technology able to have that empathetic approach as we are as humans? And then the worry of, will robots replace us? Interesting. So I'm no, but there is definitely there's definitely the option there for robots to really support and augment what we do in practice. And one of the articles here on the slide was, again, I think taken from I think it was Japan, whereby robots were used to support patient movement or and help provide personal care. And actually, what that found was actually the individuals, the patients that were on the receiving end of those robots, actually quite liked that. And there's a cultural element to this as well, that they felt much more dignified dealing with a robot rather than a human, that they were able to be in control of that situation a little bit more. However, some patients perhaps wouldn't like that. They would like that human interaction. So it's definitely thinking there of perhaps, what does the patient want? What do our citizens want? Interestingly, though, there's a question that's posed is, does this challenge our notion of what care is? So if it's all about patient rapport, empathy, and human touch, but technology can't really provide, especially some of those, especially the human touch element, so what is care? And I wonder what that is. Is it what the patient says it is? Interesting, just something for you to think about. Does technology then put us in a professional crisis because we're questioning what our initial beliefs were about care? What do we need to do in order to aid that? Again, to me, that's about making sure we as the human have the oversight of the technology that we're using. And ultimately, and I think the most important element, is thinking about, what does the patient want, not us making the decision of whether the patient would like to use that technology or not, or what they may think. It's actually involving them in that discussion as well. So thinking about digital in practice, technology can augment practice. It can support us in delivering really highly complex care. It can promote much more critical thinking than ever before. What we're presented with today is much more information about the patient, much more holistic information about the patient, rather than pockets of information located in various parts. Increased MDT collaboration relates to that point as well, is making sure that we've got that visibility of all care providers with that individual as well, and also for that patient as well. I think designing new technology and new workflows requires us to work together to make sure that we are providing a really safe digital workflow for patients. I think there's some interesting elements to think about as well, is around professional trust as well, removing some of the duplication of perhaps certain assessments that are duplicated across the professions, and making sure that we can rely on each other's information that we gather on our patients. Technology can really help us address gaps and skill deficit, and I think we've seen that through the examples as well. However, to keep up with this, we need change to professional education as well. This is a huge element, not just from the workforce, the new workforce coming into healthcare, but also our existing workforces as well, is ensuring that we're able to keep up with this ever-changing world as well. Let's move to the next slide. So, are we ready for this? I was going to spend a bit of time on this, but I'm aware of time, so I'll let you read through this as I talk. The reason I chose this example is this was a nurse and an analyst developed a tool around reducing fall-related injuries. They saw the problem. And then they work together using their EPR data. And the reason why I chose this example is it's the exact same EPR that we use in our acute services at MFT. And they developed a tool to help support identifying these patients and moving away from a one-size-fits-all assessment. What they wanted was actually a really personalized essentially care plan for patients at risk, and being really clear of what risk was as well. The bit that I wanted to just call out is, so we've got them defining the problem there, what they wanted it to do, we've got the design, but what was really clear in this, it wasn't just about the technology. What they did right at the start in the design is making sure there was really clear clinical process, clinical guidance, and clinical standards to ensure that was driving the digital, not the other way around. And that's a really important element to take away as well. And then what they delivered was an assessment tool that was assessing the patient every 4 hours and provided that personalized list of precautions for that patient that then the nurse or healthcare professional could choose to accept. So is that something that we could be doing now? Quite possibly. We have a lot of data in MFT. We're in a unique position, and we've got some of the best people and best systems in place to enable us to do that. But let's have a look a little bit further if we just move to the slide. Next slide, sorry. So really interestingly, looking at what do the public and health professionals think? So this was a piece of research undertaken by the Health Foundation. And you can see there, these are just some of the findings. You've got the link to the report there. Worth a read, really fascinating. There was a general feel that AI could impact the human dimension of care, as we previously discussed. However, the public want us to be in charge of the AI. That's what the middle graph's really saying. They want to ensure that healthcare professionals are overseeing what the AI is doing. So they're making the right decision. And ultimately, I think that relates to the trust of the healthcare professional as well. So that was interesting to see that the public are accepting of AI. They see it as a real supportive tool in their care. The final graph you've got there is looking at professions as well. And what that's showing is, I guess, who's ready for AI or technology across the professions. And it's our medical and allied health professions that are definitely the most eager, according to this piece of research. Interestingly, nursing and midwifery and admin are a bit more on the fence. They're sitting much nearer to the 50%. So there's still some work to be done there. But I think on balance, the public and health professionals are supportive of use of AI in health, in clinical and admin domains as well, which I thought was an interesting finding. I think a lot of focus around admin, but there seems to be that appetite there for that clinical element as well. However, having said that, there's still a decent proportion of some people that are unconvinced there, public and healthcare professionals. It's clear that we can make productivity gains, sorry, and that we've seen that throughout the examples as well. But there still needs to be some reassurance there, and there's the real emphasis that patients, the public, want their healthcare professional part of that decision-making process. It's not just left to the technology. It highlights, as I mentioned, around the concerns of potential loss of empathy. So again, thinking how technology can be enabled whereby both as healthcare professionals we're empowered, but the patient understands where the technology works and how it can support that interaction that we have with our patients. Decision making and accuracy, again, going back to the point of public confidence, but making sure that the healthcare professional is absolute paramount to that. And I think, as we can see there, there's some variation between the occupational groups. There's probably something around education again there. Let's move to the next slide. So making sense of it all. So what we've really gone through is some real complex areas of digital and how that will impact care and the opportunities ahead of us. So I think recognizing at first this is complex stuff. It has significant impacts. We've seen some of the limitations, whether that's professionally or whether that's from a care point of view or just from the technology in itself. But there's some real promising prospects there. Where we are at the moment in the world, widespread use of internet connected devices. So that really does position AI, telemedicine to enhance healthcare, and it's accessible to people as well. Therefore, our patients, that relationship changes. Patients are going to be, and will continue to be much more consumers of their own healthcare. So therefore, the demand for faster and more accessible care will continue to increase. So that's where we have to continue to work with technology, policymakers, ensuring that data security and privacy is absolutely a must. To do that, though, we need the understanding of data and AI to support resistance to change, enable the adoption in our practice, and obviously having that education as well will all help us make sense of this rapidly evolving world. Just move to the next slide, please. I'm not going to go through this. It's a very busy slide, but this is something that we use in our innovation groups. And these are some of the questions that we will ask when there is new technology, new AI, is understanding what problem we're trying to solve, understanding the safety impact, and getting into some of the more detailed areas around fairness, transparency, accountability, trustworthiness. But this is my gift to you, I guess, is you can be asking these questions as well. So if you're working with technology or looking at adopting new technology, these are some of the questions we should be thinking about. First of all, understanding that problem is paramount. Technology may not be the answer to it, maybe just a simple process that we need to change. But understanding that in and out is really helpful. And then understanding that safety impact is absolutely vital. But have a look at those, use them as you will, but good to have in your back pocket. If we just move to the next slide. So I think from an MFT position, we're in a really good position as an MMAP group. I think it's incredibly bright that we have the opportunities ahead of us to continue to develop digital and how that impacts our professions. We do need more MMAP-led digital research. There's not enough out there from the NHS, from the UK. A lot of the examples that I've shown are predominantly from elsewhere. So Asia and the Americas as well. So we need to be doing more. And that's my ask to you really, is thinking about how could you contribute to this research pool. We're really lucky from a Northwest point of view. We now have, I know this is just nurse, but I think they had to start somewhere, so apologies to the non-nurses, but it's all very helpful. Northwest Nurse-led Digital Research Programme, that's led by a colleague, CNEO, who is at Alderhay, and he's bringing together a programme of understanding how we can develop that nurse-led research, digital research, should I say, much more. So at the moment, it's in its early phases, just understanding what all our organisations are doing across the Northwest. Then there'll be through that is defining what good looks like as well then, and then looking at those funding opportunities and really letting that take off. Obviously, as Jude kind of presented right at the start, Catalys has a huge role in this as well, and how we work with Catalys and how Catalys works with us of identifying those opportunities as well and supporting us developing that research capability as well. We've got great academic partners around us as well on our doorstep, really, at MFT, and they're so eager to work with us. And we're really lucky to have such close relationships with those individuals too. Clinical Data Science Unit, so CDSU, unique to MFT as well. Excuse me. Is a fabulous, I think it was set up last year, is essentially, it operates a trusted research environment, massive amounts of data that comes out of MFT, and they're responsible for developing this huge database of information, all meeting really high standards to ensure really high quality research essentially. So we've got that on our doorstep as well that we can be using and thinking about. And I'd recommend you to have a bit of a look into that as well, because they're doing some fascinating work. I think they've already supported over 200 research projects as well. So it's a great resource. We're doing some great stuff here in MFT. We've got some great tech out there. We're using VR. There's lots we could be doing. We're in a fantastic position. So I really do encourage you to think about NMAHP-led research, digital research. There's lots of opportunities. And please speak to my team. Please speak to me. Please speak to everyone that's on that list there. We'll happily support and have those discussions with you. That takes me to my final slide. So I asked ChatGPT of what the future would look like. So I said, show me the future of nurses, midwives, and allied health professionals using data and technology. This is what it showed me. I will let you make your own judgments of if this really is our future. The patient looks very calm, but no one seems to be looking at the patient. And again, highlighting the importance of the human overseeing the technology and AI. Any of you that are very pernickety, maybe it's just me, if you look at the person in the grey jumper, he only has half a stethoscope, which is a bit strange. So the AI doesn't always get it right. And again, goes back to my point of making sure that we are completely overseeing the technology and AI. Thank you very much. It's been a pleasure. Is there any questions?
Speaker that I'm so